edition of the program Health Revolution right here on Echo FM 100.7 Owerri. Echo FM, get addicted to us. There are some people that sleep and wake up with Echo FM. We appreciate you. We see everything you do for us. Without you, we would not be here. So I acknowledge your effort, okay? I acknowledge your support. And I'd like to say thank you so much on behalf of everybody here at Echo FM 100.7 Owerri. Thank you, Buruburu, for handing over the MIC to me this lovely Wednesday morning. And it's midweek already. How time flies. See, July is almost coming to an end. I know of some people that made lots and lots of resolutions in January. Time will come. I'll begin to ask you. How far now? Marv King, did you make resolutions in January? How far now? We are in the almost, we are in the middle of the year, right? Almost tilting to the end of 2026. But it's not too late, okay? That's my message this morning. It's not late. Don't allow anybody put you under any form of pressure. Take it one step at a time. My friends have all bought cars. What am I doing? It's July. I have not achieved anything. You are not your friend. Your destiny and that of your friends is absolutely different. They are not the same. So please don't allow anyone put you under any form of pressure. I know why I say these things when I come here. Why? It's because I want you to protect your mental health. Okay, we are living in a time where things are very, very difficult. People are struggling. But somehow when you turn to your right, you see some other people living seamlessly. Just like as if they are not even feeling the effects from the economy. And you'll be wondering, what's going on? What am I not doing right? Yes. How come this person is earning more than me? Or how come this person is making a lot of money and I'm not? Well, so maybe it's time for you to re-strategize, okay? Don't keep doing the same things over and over again and expect the same results. That's a popular quote we all know. Yes, so that's a message I would want to pass on this morning, and together I would make the world a better place. My name, as always, is Mary Omeniwode, the Slim Diva, your most adorable, and I'm here this morning with DJ Marv King. We'll have a guest join us via the phone. I will try as much as I can to connect to him, and I pray that network will be favorable this morning. So let's see if it's going to connect. But while we're trying to do that, I have just one update for you this morning. Okay, so we are getting the information from the NAFDAC DG, Professor Mojisola Adeyeye, the Director General of the National Agency for Food and Drug Administration and Control. Professor Mojisola Adeyeye saying that the agency has uncovered the continued illegal production of banned alcoholic beverages or drinks packaged in sachets and PET bottles below 200 milliliters, despite the federal government's nationwide prohibition of the product. Now, she said investigations revealed that factories traced to banned products circulating in the markets were still actively producing the alcoholic beverages, adding that the items were not old stock as claimed by some of these operators. So she further alleged that some manufacturers had relocated their production machines to unregistered premises to evade regulatory authorities, while others removed their company signboards to conceal their identities from enforcement officers. Nigeria, my country. So there's a directive that any vendor, anyone who sells, alcoholic beverages, the PET bottles, the sachets, should stop immediately. I think that directive was given last week or so. But as I speak with you, manufacturers are still there producing. They're not send NAFDAC, and they're now coming up with strategies to evade arrest. They've started reassigning their signboards. Some even totally remove their signboards. So when you go, you would not even notice that anything is going on in those companies. And the NAFDAC DG is saying clearly that if you are caught as a manufacturer, as a seller of any of these banned alcoholic beverages, you will be made to face the wrath of the law. Okay, so let's go over to our guest for today, Dr. Onwukwe Uzoma. Are you with us this morning? Good morning to you.
Yes, good morning.
Good morning. So sorry to have kept you
It's good
waiting.
to join you on the program again.
Thank you so much. Dr. Onwukwe Uzoma is a pediatrician and pan IPA immunization champion for Imo State. It's good to have you join us this morning, Dr. Uzo.
Thank you very much, Slim Diva. Good morning. Good morning, Himolites.
Okay, so we'll go straight up into the conversation. I know you're quite busy and on call this morning. Recently, I saw a news article, especially on Punch newspapers, stating clearly that parents should stop giving their children, especially those under 5 years of age, adult medication, warning that the practice could go on to lead to severe consequences. And I was amazed when I saw that, because I know it's a common practice in this part of the world. A child is having headache and the mother remembers that, oh, she has the normal paracetamol that we all know, right? Or pain reliever, prescribed maybe by her doctor for her, or for her husband, or for her spouse, or for any other adult in the house. And the moment this child comes down with a severe headache, she goes straight up to her medication box, gets that particular medication that was prescribed by a doctor, and administers it to the child. Now, that's a common practice in Nigeria, but I'm shocked to note that pediatricians are saying it is wrong. So that's what we'll be talking about, Dr. Uzo. I'll quickly hand over to you. Why should we pay much attention to this warning by your colleagues?
Okay, thank you very much, Slim Diva. I hope I'm coming across as clear as I think I am.
Yes, it's okay. Go ahead.
Oh, okay, thank you. Yes, so in recent times we have looked at it, and well, it's not a recent conversation. Maybe we're just bringing it back to the forefront once again, for parents to understand that children are not small adults. They are not small adults. Yes, we understand that this is indeed to try to help for various reasons. The parents are trying to help. And part of the reason why we are having this conversation is that these children are not just smaller adults where you just have the dose of what the parents take to give to the child. Now, this is because, why we're saying this is because a lot of these children, their livers are immature, their kidneys are immature, they have a smaller body size, and it's not just enough to the child falls ill, and then you just assume that having the dose makes sense to give to this child, because there's a lot of danger to this practice, which is common in not just our environment, but in different places. Another thing we need to understand about this is that because of when we talk about the body size, because we have to consider things like the child's age, we have to consider the child's weight. Yes, there are some children who their weights, by the time you calculate their medications, by the time you calculate the medications, you can actually give some children adult doses. But these things are best done by the proper healthcare professional, so that these children don't run into trouble. Some of the other things that we also put into consideration are things like the fact that some of these children have other existing illnesses that may require you to even give just about 75% of the medication, so that you don't put too much of a strain on some of these organs that we mentioned that are still trying to gain maturity.
Okay.
Yes. So I think what is worth also mentioning is the common practice of giving every child that is coughing cough syrups. Now, it is maybe, I don't know, I don't think maybe it's not common knowledge, but I think I want to bring it up to people that children who are under 5 years should not be giving cough syrups.
For real?
Now, Yes. Now, so the idea is this. The reason is this: is that I'll cite a few reasons. The reason is this: is that most cough now, if you if you're eating, or let me say it in Igbo, what you do is that you cough, and what it means is that the cough reflex is a protective one. So the cough is to stop whatever it is that is trying to get into your lungs from getting in there. So cough is like a protective, is something that was placed there by the maker as a protective, to protect the airway, right?
Mm-hmm.
Now, most of these cough syrups have suppressants, and these suppressants work centrally. When I mean centrally, they work in the brain. So what it means is that if you give a cough syrup to these smaller children, you run the risk of, if you suppress the cough, so if the child has an issue that the child should cough to push whatever it is away, the child can't do that.
Wow.
Two, some of these cough syrups will cause drowsiness. So if you're looking at a smaller child who's less than 1 year, who ideally should wake up on their own when they are hungry to feed. So you run the risk that the child sleeps for so long and will not, or remains drowsy and is not able to eat. And for two reasons: child wouldn't wake up to eat, the sugar goes too low, the child could die from there, or the child is too drowsy to control swallowing. And then the food enters into the wrong place, and then we're discussing other things. So it's generally advised that children who are less than 5 years should not be giving cough syrups. Another reason is that most times cough can be part of the signs of a pneumonia. And if you suppress the cough, the idea is that the parents feel that, oh, the illness is getting better, is going. Meanwhile, what is going on is getting worse in the background. And then you see most of these children now coming with severe illnesses and all of that.
Whoa.
So the idea generally is for children should see a healthcare professional. Children should see a healthcare professional.
Okay.
Children should see a healthcare professional so that they are prescribed the right dose for their weight, for their age, for the particular illness.
Yeah.
Okay? Yes, and then that the parents get proper information, because I would like to also mention that sometimes the parents may make these errors. Like I said, they try to genuinely help the child, but sometimes these errors are made either because they don't want to ask the healthcare provider questions. The healthcare providers do not assume a position of God. You should ask questions where you are confused. Sometimes some parents may forget instructions, or they may misinterpret instructions, and this may lead to some of these errors, which are honest mistakes. But what we're discussing today is where parents, whether by omission or by commission, decide to treat their children as small adults, and then we have the doses of the adult doses.
Medication. Okay, so yes. No, they are intertwined though. We cannot separate this last issue you just raised, the issue of administering cough syrup to children under 5. And I feel it's not like these parents don't want to ask questions. The truth is that majority of them are not aware. Trust me. If I say that this is my first time of hearing this, although in the course of my, sensitization on air with a lot of experts, I know this has been mentioned. But the truth is a lot of parents, a lot of adults do not know that it is wrong to administer cough syrup to children under 5. So it's very important we mention that as well. Now you have talked about cough syrup. What of painkillers? That's another thing that a lot of people abuse. I have seen a parent, like I said when I started off this program this morning, administering the normal dosage of paracetamol to a child. Is that right?
Okay, thank you very much, Slim Diva, for that question. So now it's actually wrong. I'll start with this. Most of the manufacturers of these medications, especially for paracetamol, if you look at the container, that's the pack of the paracetamol, there's an age, especially for the tablets, there's an age that they wrote there, and it's clearly written. The reason why that age is written there is because it's assumed that the average child, now we have the average child who is that age can take either half the tablet or some form of safe tablet, right?
Okay.
But every child of the same age cannot be assumed to be in that average category. That's one. So there's a reason why they write those ages there. Now, secondly, is that for paracetamol, most of paracetamol painkillers, most of them, including ibuprofen, that a lot of people abuse these days, is notorious for causing kidney failures in children, some form of kidney injury in children.
Wow.
Now, the ibuprofens and the diclofenacs. Now, the part of the conversation here is that these drugs are excreted after they've been taken. The body breaks them down. And for paracetamol, majorly it's excreted by the liver.
Okay.
And for ibuprofen, majorly it's excreted by the kidneys. Now, if you take more than the dose that a child should take per time, what you're doing is that you're now putting more work and more strain on the liver and or the kidney, depending on what medication it is. And with every repeated period, little injuries at a time, and then before you know it, you have a very big picture where the child comes down with an overt problem. And then we now start discussing, how did we get here?
Wow.
So it boils down to dose dependent. The dose is dependent on their weight majorly, especially for children, because you cannot be discussing give 1 tablet of paracetamol to a newborn,
Okay.
and you also give 1 tablet of paracetamol, let's say for example, I'm not saying that's the dose, but for example, a 12, 13, 14-year-old, because you said, it's a child. Since adults take 2 tablets, a child can take 1. So every child is not the same. So it's dose dependent. Because we've had situations where we've had 1-month-olds, they come in with signs that look like what looks like liver failure. Why? Because a lot of mothers now feel that paracetamol is part of the routine drugs for a newborn. So every day, twice a day, a newborn gets paracetamol because the mother assumes that the child has cried a lot today, so she should give paracetamol
1
twice a
month
day.
old.
Yeah, even children younger than that, they have different
God.
names. I'm not here to call trade names and all of that.
Yeah.
And then even some of the drugs that they assume are for teething, when you read the contents of the drugs, now I want to say it on air here that teething is not an illness. Ipoeze awuhu oria.
Thank you.
That you need to give medications for. Now, ipoeze awuhu oria, and because of this, a lot of parents have kept children in the house, giving them, in quotes, what they call teething medications. And most of these drugs just contain paracetamol. Some of these children are on these medications for months on ending, putting strains on the liver. And then most times, by the time some of them even start having things like diarrhea and vomiting, and people are saying that, no eze. Ipoeze is not an illness. If a child is sick, if a child has fever, if a child has diarrhea, if a child has vomiting, that child should see a doctor, a pediatrician, or a doctor at least who will evaluate the child. That's not the child you should keep at home and then start dosing all manner of medications as if teething is an illness. Okay. Imagine this, if teething was an illness, with all the teeth, all of us listening, have in our mouth, what it means is that because the average person has about 28 to 30 something teeth in the mouth. So each teeth that came out was an illness of its own. So, but we need to go back and think about these things. We cannot keep pumping medications to growing kidneys, growing livers, growing organs of these children. The damages are dose dependent. So every day you come with a razor blade, on a thick book, over time you eventually get into the book and destroy the book.
Very true.
It may not happen at once, but eventually, as you keep flogging those organs, eventually injury will occur, damage will occur, organ failures will occur, and that's what we're here to discuss to prevent, because we need our children growing into adulthood on their own terms, not because someone in trying to help or out of not knowing causes a sincere damage.
Yeah. Well, it's good we're having this conversation. Thank you so much, Dr. Uzo. So we've mentioned painkillers. We have mentioned, what is it called now? Cough syrup. What of antibiotics? Is that also something that parents should be aware of as well?
Well, thank you very much for bringing up this issue. I honestly hope that it wasn't going to come up because this is an ongoing battle for us in not just in Owerri, not just in Nigeria, but the world. With something we call antibiotic stewardship.
Yeah.
Antibiotic stewardship, because of our access to antibiotics is being abused by everybody now. Nobody is left out. Healthcare workers, parents, those who are trying to help, whoever you call it, everybody seems to be abusing antibiotics, even including some some farmers who give it to unprescribed from the veterinary doctors who give some of these medications to their what do you call it, to the and livestock that they are, but that's something else altogether. So we're staying on the side of antibiotics stewardship, because for antibiotics to be given, there has to be an indication. Why are we giving it? Every fever is not